Joining me now is Clinical Director of the Division of Infectious Diseases at Brigham and Women's Hospital, Dr. Paul Sachs. Doctor, thank you for being with us this morning. We want to start by asking you, what are the risk factors for the president? Because we know that he has a couple of underlying risk factors.
Most important risk factor for the severity of COVID-19 in study after study is older age. And of course, as being a man in his 70s, he is at risk for a more severe outcome. I really want to emphasize this. It can be a severe disease at any age, but as we get older, decade by decade, it becomes more of a serious condition.
And the president is tested all of the time. So this leads us to believe that he must have been exposed recently.
Yeah, the incubation period for COVID-19, the time between exposure and getting the positive test is between 2 and 14 days, and it averages about 5 days. So if we were in the process of doing contact tracing, we would kind of go back between that time and go forward as well. So this is a very important development, and he is obviously around a lot of people. He's not always wearing a mask. In fact, he rarely wears a mask. And this is going to be a very important ongoing investigation.
There will certainly need to be a lot of contact tracing. He's been campaigning in person. He's the president, of course. So how concerned are you that other government leaders in the White House in D.C. have been exposed?
Well, anybody he's been in a room with, especially in a room for more than 15 minutes at a time when people are not wearing masks, is potentially exposed. People are at their most contagious in the couple of days before they develop symptoms, and then several days afterwards. Now, we don't know if he has symptoms, and we don't know when the onset of infection, but presumably it was relatively recently. And so the people who are at greatest risk would be those that he's working with around this time period.
That's right. As far as we know, his physician did say this morning that he and the First Lady are doing well and not showing symptoms. So that remains to be seen. But we know that it's reached the highest level of government now. So what would be the key to stopping the spread inside of the White House?
The key is the same inside the White House as it is outside the White House. It's testing, isolation, and then for a period of time of at least 10 days, it would be quarantine. So those are the kind of things we would do for someone who has COVID-19. We would give that advice to someone who's recently been diagnosed. So what we recommend is that they stay in essential quarantine for about 10 days after they have had the onset of symptoms, and then also with complete resolution of the symptoms as well.
Dr. Paul Sachs, thank you so much for joining us, for your expertise and your insight this morning.